Stiff person syndrome. SPS is a rare neurological disorder characterized by progressive stiffness and muscle spasms in the trunk and limbs. An abnormal immune response causes inflammation and nerve damage, which causes the condition. SPS symptoms can include muscle stiffness, spasms, and rigidity, particularly in the trunk and legs. Stress, infection, or other environmental factors can cause these symptoms, which can cause difficulty walking, standing, or even sitting. Some people with SPS have difficulty breathing, swallowing, and speaking. The exact cause of SPS is unknown, but it is thought to be an autoimmune disorder. In SPS, the immune system misidentifies the nervous system and attacks it, specifically the inhibitory neurotransmitter GABA. This causes increased muscle tone and spasms. SPS diagnosis can be difficult because symptoms can mimic those of other neurological disorders, such as multiple sclerosis, spastic paraplegia, and dystonia. To confirm a diagnosis, a combination of medical history, physical examination, and imaging tests, such as MRI, may be used. SPS is typically treated with a combination of medications, physical therapy, and other supportive therapies. Muscle relaxants are frequently used to alleviate muscle stiffness and spasms. Physical therapy and other complementary therapies, such as occupational therapy, can help to improve muscle strength and flexibility while also increasing mobility. Surgery may be recommended in some cases to help relieve symptoms. While there is no cure for SPS at the moment, treatment can help manage symptoms and improve quality of life. It is critical to visit a healthcare provider on a regular basis to monitor symptoms and make any necessary adjustments. SPS is a rare disorder, but early diagnosis and treatment can help improve outcomes for people who have it. Various types of stiff person syndrome. SPS is classified into several subtypes or classifications, which include: this is the most common type of SPS, GAD, glutamic acid decarboxylase. Antibodies are associated with it, but other antibody associations have been reported in studies. SPS variations. Several SPS variants can affect specific parts of your body or cause more severe incoordination, ataxia. Progressive encephalomyelitis with rigidity and myoclonus, PERM. PERM is a more severe form of SPS that causes loss of consciousness, problems with eye movement, ataxia, and autonomic dysfunction. Because of autonomic dysfunction, PERM is frequently managed in a hospital. Who is affected by stiff person syndrome? Women and people assigned female at birth, AFADB, are twice as likely as men and people assigned male at birth to have SPS, AMAB. Stiff person syndrome is extremely uncommon. The syndrome affects about 1 in every million people. How can stiff person syndrome be identified? Stiff person syndrome is difficult to diagnose because it is uncommon, and its symptoms are similar to those of other conditions such as ankylosing spondylitis, multiple sclerosis, and autoimmune conditions. What is the prevalence of stiff person syndrome? Antibody blood test. A blood test can detect the presence of GAD antibodies or other relevant antibodies, as well as other symptoms that may indicate or rule out other diseases. Electromyography, EMG. This test measures electrical activity in your muscles and can assist in ruling out other possible causes of your symptoms. Lumbar puncture, spinal tap. A lumbar puncture is a procedure in which a healthcare provider draws fluid from your spinal canal to test for the presence of antibodies to GAD. They will also look for other symptoms that may indicate or rule out other conditions. What is the outlook on stiff person syndrome? Stiff person syndrome is a long-term, chronic condition. The prognosis, outlook, differs from person to person depending on a number of factors, including the severity of the symptoms. How effective treatment is? It is critical to begin treatment as soon as symptoms appear in order to prevent or slow the progression of the syndrome and avoid long-term complications. Medication helps most people with SPS, but it can still be difficult to manage triggers that cause muscle spasms. Walking can become increasingly difficult over time. Your ability to perform daily, routine tasks may deteriorate over time as well. As SPS worsens, the increased risk of falling becomes a growing concern. Some people may require the assistance of a cane, walker, or wheelchair.